And I think we're going to start today with the COVID-19 update to see what the situation is currently. So Steve, if you...
Good evening, board members. So the total cases since March 2020, which is when we started tracking COVID, is at 5,746 cases. We now have 160 active cases. That's actually going in the right direction. It's gone down 54 cases since last week. In the last 24 hours, we've had 8 cases. In the last week, we've had 71 cases, and that's compared to last week is down 23 cases. In the last 2 weeks, we've had 180 cases. That's down 82 from October 8th. Since September 14th, which would be a 1-month period, we've seen 536 cases. That's down 27 cases as compared to October 8th, 1 week ago. And then deaths since March 2020 is 153. There has been 1 death in the last week since October 8th. Our positivity rate, we're looking at 5,052 tests in the city, 241 positives, which puts us at 4.7, which is down 9.9%, or 0.9% since last week. So numbers are a little bit more promising. I might comment that from age 0 to 12, there are 44 of the 160 cases, 44 of them are 0 to 12 years of age. And then 13 to 19 is 23. So about 67 cases out of the 160 active cases are under 20 years old.
Do we know, Steve, how many of the people over age 12 who got COVID or tested positive were vaccinated and how many weren't vaccinated?
I don't have those figures with me. However, I could look them up as the meeting goes on and report.
All right. Just curious as to how we're doing, protecting people with vaccination. Lastly, and it's a little bit of a different subject, I think there's going to be an inspection tomorrow of our facility or of the vaccination facility. Did you know anything about that?
I do not know anything about that, no.
I think Dottie had responded to that and said she would be available tomorrow. It's I think someone from Boston, if I understood, just coming out to see how we were storing.
Oh, I'm sorry. You mean in our office? Yes. Yeah. The mass immunization, MIIS, will be coming out to do an inspection on the office, basically looking for how we store vaccine, how we vaccinate, and basically the process of recording the paperwork end of things during vaccination. So yes, I'm sorry, there will be an inspection tomorrow of the office.
And what will they do with the data that they get from that?
Well, they keep track of how well we're doing. They'll score us on all our activities, and we'll have some sort of a final score on how we rate overall. And if we don't rate well, then we don't give vaccine anymore or store it anymore. So.
Okay, that's what I was going to ask, whether they would put in remedies to help us.
Yes, I would assume if there were violations that they would allow us time to correct those violations. I think it's more to make sure that we're properly educated and doing things the right way, according to regulations.
Super. Well, I'm going to say these acoustic devices are very helpful. I'm hearing pretty much everything you're saying. It's great. All right. Well, I think that concludes the COVID-19 update then for this meeting. And shall we move on then to the petitions? Am I getting that in the correct order?
You are.
Okay. And I think We have Jacqueline Wetchy, if I'm pronouncing that correctly.
Yes, you are.
Thank you to give an argument, I think, to rescind the Board of Health mask mandate in municipal buildings, schools, and Fitchburg Housing Authority. So,
Thank you.
Thank you. I did receive some input.
Before,
on
Ms. Wetchy, before you talk, can you need to be in a microphone because we are on television.
Okay. I did receive some input in preparing my presentation today from Attorney Pusateri and also from Mr. Andrew Cordio. If you hear anything you like, you can give us some credit. Any errors, I take full responsibility for. This is a petition to remove the city mask mandate. You turn to the next page. Since I last petitioned to remove it, we've had new direction from the federal government. President Biden has said that COVID-19 is a pandemic of the unvaccinated. He's put in vaccine mandates in recognition of that's the solution, not masks. Despite a mask mandate here in the Fitchburg Public Schools, it was reported at the last Board of Health meeting that every school but one has had a COVID outbreak. The masks are not stopping the transmission of the small COVID particles, thus the push for mandates. Next page. Over the course of the pandemic, the state's response has also changed. The Commonwealth state of emergency expired on June 15th. We have vaccines readily available for all who want them, including booster shots now. We have treatments. At the last Board of Health meeting, Steve Curry presented that COVID deaths had decreased 10 times year over year, from 81 down to 8. Yet the Board of Health put in restrictions that we did not have in place at the height of the pandemic. It's almost like a negativity bias. Rather than celebrating the progress that we made, you're putting in more restrictions. Things are improving, as noted in today's COVID update, and if you look on the next page, you see that in Massachusetts, cases are going down, the positivity rate is going down, hospitalizations are going down, and deaths are going down. The source for this is the DPH. I also have signed up for emails from Becker's Hospital Review, and as of the 12th, we are tied with Rhode Island for the second best in the nation in positivity rate of 1.8%, and second best in COVID hospitalizations per capita over the past 14 days after Vermont. Massachusetts is doing really, really great. The next page is specific to Worcester County. This is from the CDC weekly tracker. ICU beds in use has gone down. The graphs on the left, cases have gone down, deaths are flat and at a very low level. And on the right top, you see the positivity rate is also declining. On the next page, the city must use a rational, factual basis for their orders. One way you can determine if our orders are reasonable and rational is by benchmarking ourselves against other communities. I like the analogy of an invisible fence. If you have an invisible fence, the dog gets near the fence, it gets shocked. It can't leave the yard. It's stuck in the yard. We're not dogs in an invisible fence. We're not confined to the boundaries of Fitchburg. We travel freely throughout the region, so we should be looking at the larger community. Many adjacent communities are not issuing these same orders that we are. Leominster isn't, Lunenburg isn't, Westminster isn't, and it's not because our data is so much worse than theirs. When I looked a few days ago, the positivity rate for Fitchburg is 5.6. To hear today that it's 4.7, that's great, even better. Leominster was 4.71, which is lower. Lunenburg was 6.94, which is higher. Westminster was about where we are. Worcester County as a whole, 2.55%. Massachusetts, 1.8%. So our city, county, and state all have lower positivity rates than the previous time period ending September 30th. The next page. Individuals are responsible for protecting themselves via vaccination. And we know that vaccines protect. The CDC did a study showing that the unvaccinated are 10 times more likely to die and 11 times more likely to be hospitalized with COVID. Common sense, but I wrote it down anyways. No one can get a vaccine for another person. It's a matter of personal responsibility. They're widely available at no cost. State mandates already cover settings where those too young for vaccination spend large amounts of time, such as schools and daycares. A city order is largely redundant and it's unnecessary. Next page. There are no serious risks, the serious risks to those too young for vaccines are negligible. I just read an article yesterday in Boston.com quoting the Mass DPH. There have been no COVID-19 deaths among children in Massachusetts this fall, 0. The children who have died of COVID over the course of the pandemic, for the most part, have been already seriously ill with complex disabilities. This is from an article in Nature magazine. And high health care needs such as tube feeding or assistance with breathing. It's not the type of children who will be running around in municipal buildings. Furthermore, I checked with the city clerk in Fitchburg, and she was nice enough to check back to the beginning of the pandemic all the death records for the city. There have been no deaths of children ages 0 to 11 in Fitchburg over the entire course of the pandemic, and this is the age group that is too young to be vaccinated. Next page, you see the same thing in the country at large. The graph on the left has the youngest ages at the top, the older ages at the bottom. The younger ones are such a small figure that you can't even see the blue bar on the graph. The next page, the same is true in Massachusetts as it is in the country. On the far left-hand side, there's a graph with bars, vertical bars, and this is, again, a breakdown by age of deaths in Massachusetts. This is data from the past 2 weeks. It's not historical data reflecting nursing home outbreaks early in the pandemic. And you see that no one under the age of 20 died within this time frame. The biggest group are the octogenarians in the far right column. It's the older people who are dying, not the children who can't be vaccinated yet. Next page are hospitalizations by age in Massachusetts. This shows the same thing. The older you are, the more likely you are to be hospitalized with COVID. Next page, people have a fundamental right to control their bodies, including their faces. The 14th Amendment to the Constitution says that we shall not be deprived of liberty without due process. I feel we have not had due process because the Board of Health passed the mask mandate when we do not have a state of emergency in the Commonwealth of Massachusetts. And the last thing I wanted to do was close with an anecdote. The last Board of Health meeting, I presented data, as I have tonight, and after I made my public comment, one of the city nurses got up and said, and I'm paraphrasing, "Your data doesn't mean anything. Data can mean anything. What matters is my personal experience of the pandemic." So here's a personal story of the pandemic. Last month, I went to get my hair cut, and there was a new guy at the salon working, and I got to talking with him, and he said, "Yeah, I used to work at a different salon, and all the employees got vaccinated, but the 2 owners refused. And then the owners told us, you need to wear masks all day long to protect us because we're not vaccinated." He said he wasn't putting up with that, and he quit. That incident writ large is really what your mandate is about. It's forcing people like me who are vaccinated to keep wearing masks to protect people who could get vaccinated but who are refusing to protect themselves. It's not fair, and therefore I do ask the Fitchburg mask mandate be repealed effective immediately. If you want to put in a mask advisory, that's fine, but it should not be a mandate.
Well, thank you. You've done a lot of research, and obviously we haven't had a chance to look at this in detail, but I think you've done a good job in summarizing it. I'd just like to ask you, first of all, you're not arguing against masking for children in school, if I'm understanding. It's primarily in municipal buildings outside of the school setting?
I'm not protesting the state mandate that covers schools. I'm saying we don't need a city mandate in addition to that.
Yeah. Well, what's the difference between a state mandate and a city mandate within the schools?
Well, I don't have any standing. I'm not a child in the schools, and I don't have a child in the school, so that's not an issue I have any standing to contest.
Yeah. And what is it about wearing a mask that you're finding so onerous or so bothersome? I'm just, obviously you're very passionate about this. I'm just wondering what it is that makes you so passionate about it. What is it that's bothering you about wearing the mask?
It's uncomfortable, it makes me hard to breathe, it fogs up my glasses, I have trouble seeing, and I feel like I got vaccinated for nothing, and I'm being punished by being forced to wear a mask. What did I get vaccinated for? I got vaccinated so we could get back to normal, and you're not letting us get back to normal.
Well, I don't want to argue with you, but you obviously got vaccinated to protect yourself. I don't think you run the risk of getting ill the way you would if you weren't vaccinated.
I actually wasn't worried about getting ill because I'm under 60, I don't have any underlying conditions, I'm female and I'm white, so I'm not the type of person that the virus targets. I got vaccinated to get back to normal.
Yeah. Well, I think that I would disagree, and even though you're healthy, it doesn't mean, there have been plenty of people in their 60s who show up on television from ICUs every night and say, gee, I wish I had gotten vaccinated. We're not really here to argue about that. I think pretty much everyone's in agreement that vaccines are helpful and protective, and whenever individuals are eligible to get it, they ought to. We can't certainly force everyone to, but it would be in everyone's best interest to do that. I think, again, many of the beneficial or optimistic statistics you showed came about, those data came about when people were wearing masks or people weren't in school and people were separated. So we haven't really got statistics to show what would happen if everyone went around without a mask. It might be worse than this. And I think many people disagree with you, even though they find that masks are annoying and are a nuisance, myself included, that it's probably better for yourself and better, because vaccines are not 100% protective, better for yourself and better for others, because we can't force everyone to get vaccinated, to cut down on the spread of disease via droplet spread. So I think the reason that we thought the mask mandate would be important would be to protect those who weren't vaccinated, to protect the young people. Granted, it appears that young people don't get as ill, but I think we're starting to see enough of them that it's bothersome. And so it's to protect young people, it's to protect who can't be vaccinated, protect those who won't be vaccinated, and to protect those who can still get breakthrough infections. I think we're seeing that immunity from vaccines is going down, so that's why boosters are being recommended now. And so I think masks are just one of many things that we can do to protect ourselves. Granted, it's a nuisance, but I think still my own personal opinion is that it's important to do that. And I think we've also said that when we get to certain levels of vaccination within the schools, when we get to herd immunity around here in Fitchburg, then certainly we'd be willing to reconsider and to consider removing the mask mandate. But still, we have a significant positivity rate, even though it's improving, but might be improving because we're wearing masks in addition to being vaccinated. So I just think to balance off the nuisance of wearing a mask, which I agree is there, against potential that people will get significantly ill, it's still my opinion that we ought to continue to wear masks in the places that we can control. Out on the street, other places, it's not up to us. But I think in the places we can, it's better to try to remain safe.
I have a comment, a couple of comments. They're just comments. First of all, I wear a mask not to protect myself, but to protect those around me. And I think that's the whole purpose of wearing a mask. The other thing that you pointed out, which is you were right on, excuse me, it's dry in here. The positivity rate in some of the communities that you mentioned are great, but remember there's 351 municipalities in the Commonwealth. Oh, my voice is going to go, I hope not now. And a lot of the other of our sister communities are not that good. The North Quabbin region right now is getting hit very hard, and their rates are very high. They do not have mask mandates. One of the communities that I've been working in today does not have a mask mandate, and there's quite a few clusters in daycares that I've been working with, a men's hockey league. None of them had masks on, even though they were vaccinated, most of them. So it's still, I think we still need to be safe, and I think wearing masks is the right thing to do. On another note, there is a community, I believe it's Northbridge, don't quote me on that, but their schools have an 80% vaccination rate, so they are going to be eligible to have the mask mandate removed. Isn't that great?
I believe it's Hopkinton.
Is
but
it?
I could be
Okay.
wrong.
Thank you for correcting me on that. I knew it was out in that area. So that's good news, and that's what we're all striving for. It's things like that.
Well, you mentioned North Quabbin. I know that Athol doesn't have a mask mandate, and in fact, they have encouraged people to come into their library. Last month, they had a sign up for your first library card, and if you do, you can win a Visa gift card. So other communities aren't being restricted the same way. Orange is also in the North Quabbin region. They took a little different approach. They've shut down their municipal buildings except for the library, and they let the library set its own policy. And if you wanted to do something similar, you wouldn't be hearing from me. I'd be going before the library board of trustees if I didn't like what they decided.
Your main concern or complaint is the library?
Yes.
I don't know if that's something we should maybe look at a little bit more about the data on, excuse me, yes.
If I may, Mr.
Sorry.
Chairman, the library has reached out to me, and if we didn't pass the mandate, they were considering doing their own. They support masking. And I believe they've notified Ms. Whitfield about that.
Well, they told me they wanted it for their staff, but not necessarily for patrons.
Okay.
Am I right that most colleges and universities in the Commonwealth also are insisting that individuals wear masks?
I know Fitchburg does.
Yeah.
Well, it's affected by our mask mandate, and I can tell you that the school reached out to me for assistance on with some sort of an order to help them enforce it.
Can I comment on that?
You may.
So I remember at a
You
previous...
have to ask Mr. Chairman.
Yes, go ahead.
Okay, so I remember at a previous meeting that someone had mentioned that Fitchburg State came to you guys and asked you to make the mask mandate extend to their campus. You did. Now, at the last Board of Health meeting, it was mentioned that 90% of the students at Fitchburg State are vaccinated. So I'm wondering, why haven't you removed the college, which you had added previously? Is 90% not good enough for you? What are you looking for? Are you looking for 100%?
I think the state set those guidelines, not us, for Fitchburg State to be vaccinated. All state colleges had to be vaccinated. It wasn't this municipality that set those standards just for Fitchburg. It's Worcester State College, Framingham State, Salem State.
But your original order didn't include Fitchburg State, and then you added it.
That's
And
correct.
now they're at 90%, and you're not removing it, because I guess 90% isn't good enough?
Well, I think we've used 80% as the goal, and we've certainly said with regard to the high school and the lower schools that of those who reach 80% vaccination rates that we would eliminate the mask mandate. I think, as Mr. Curry said, Fitchburg State actually came to us and asked us to institute a mask mandate. And I think, I'm not sure, what the state is saying is an appropriate number, whether it's 100% or something lower than that. But I would think that, again, we've said 80%, so unless the school or state has some different number that they're going to adhere to.
I guess I question why you would let the administration of Fitchburg State talk you into basically what I would say doing their dirty work for them and making a decision that might not be popular with the students. I think if you, did a poll of the students, you wouldn't find that they're overwhelmingly loving wearing the masks. And they've all gotten, 90% of them have gotten vaccinated, and you're still extending the Fitchburg City mandate to the college.
I'm not aware of any 90%. I don't know where that number came from. I can tell you that Fitchburg State University has an issue with staffing, and I know it's not at 90%. So I don't know where that number came. I do remember hearing it, but I don't remember where it came from.
It was one of the nurses that was sitting over in that side of the room at the last meeting.
I can certainly look into it. I don't know that number, but I'm not aware that it's 90%.
So basically, I feel like, your goals are too high. Even 80%, I don't think Fitchburg is going to get to 80%. COVID is going to be with us forever, and a lot of public health experts are saying that at some point you've got to realize it's not a pandemic anymore, it's an endemic disease, and instead of sitting and counting cases and quarantining people and making people who have absolutely no symptoms sit in their house for 2 weeks, that you need to focus on treating serious illness and preventing death among the vulnerable populations. And the kind of point at which a lot of these experts say you should start considering treating COVID as endemic is when you get below 5%. We're below 5% transmission. So, or 5% positivity, you're below 5%, then why not shift your focus? COVID's never going to go away. We're going to wear masks the rest of our life. If Fitchburg doesn't get to 80% vaccination, which I don't think it will, we're going to wear masks the rest of our lives. It's not fair.
Well, I don't know whether it'll never go away. I mean, smallpox has gone away and polio has essentially gone away. Once enough people get vaccinated, or those who refuse to get vaccinated die off and aren't considered anymore. But those diseases have essentially gone away when we've been careful about how we've dealt with them, and I think the same thing will be possible with COVID. There are many ways now to vaccinate and to treat it. So, and we're essentially making good progress by doing the things we're doing, and as you pointed out, and so I think to jump off the horse now and say, we don't have to worry about it anymore, I don't think would be the proper approach.
The ACIP is still yet to approve the ages 5 to 12 for the vaccine.
But none of them are dying. The meeting on September 2nd.
They may not be dying or sick, but they're transmitting.
They're transmitting to people who could protect themselves with a vaccine but refuse.
Well, they haven't, though.
When does personal responsibility come into play? Should I never drive my car because someone else might be in a car and not wearing a seatbelt and they die? Or should they take some responsibility?
I wish people would take responsibility, but not everybody is. So that's why public health comes into play. We do the best we can with what we have. I'm hoping that that will make a difference. I am quite sure that not all parents will want to have their little kids vaccinated, but some will, and I think it'll make a difference in the schools. I hope to heck it does, because the schools are it's just a terrible situation in the schools right now. And more boosters are going to be getting approved, the Moderna and the J&J, and perhaps a mix of the different kinds of vaccines, the mRNA and the other one, J&J. And all those little things make a difference. It has to, because our rates have started to drop in Fitchburg, and I'm just talking about Fitchburg now, of all the 351 communities. This is a very high-risk community.
If it's below 5%, it doesn't look high risk to me.
And that's good.
Well, Ian, do you have any comments you want?
I do not. You've covered everything.
You're all set?
Yes, thank you.
I think I would like to make a motion to maintain the mask mandate as is for the present. I congratulate Ms. Wetchy for the research that she does, and certainly any time that you want to return and continue to give us information, we're very happy to hear it. But I think, again, keeping in mind what probably is the safest approach for the community, I would like to make a motion to maintain the mask mandate as it currently is.
I'll second that motion.
I'm in favor.
So I think we're all in favor. Again, I'm going to look at what you gave us in a little more detail, a little more carefully, although I think you've done a very good job to summarize it. And but I think for now we will plan to maintain the mask mandate as we currently have it. So I think that is it with respect to the mask mandate discussion. Were you also, at least on my agenda, it has that you were going to discuss the waste management? Is that
Yes.
also? Thank you.
And Mr. Chairman, just so you're aware, and Ms. Wetchy, Ed Pasek is a manager at Waste Management. He will be joining us virtually, and there he is.
Hello.
Hi.
So,
Hello, everyone. Mr. Pasek, if you would mind introducing yourself and your position with Waste Management.
Yeah, sure. Good evening, everyone. My name is Ed Pasek. I work for Waste Management, and I am a public sector representative, which effectively, I guess for the purposes of this meeting, I am the contract manager and manage the relationship with Waste Management in the city of Fitchburg. So I'm happy to be here tonight and discuss the services that we offer.
If I can just say, this is something that, in terms of Ms. Wetchy's complaint about waste management that I had been unaware of, and again, I may be living under a rock, but I had not been aware of any particular complaints or problems with waste management. So I think it's probably an appropriate time for you to tell us what it is that you're concerned about, and then we'll discuss it from there.
yes, the pickup of trash, recycling, and yard waste has been bad for years since we've had Waste Management. The latest excuse is COVID, but it long predates COVID. I would estimate that over the past 5 years or so, I probably sent 100 emails to Steve Curry about missed pickups. Would you say that's a good estimate?
I do have the list of emails. I don't know if it's 100, but it's lengthy.
Okay.
And just to interrupt, you're at 16 Washington Street, is that?
No.
No.
No, I'm sorry. You're talking about your home address, though, your
Yes,
own
I am.
neighborhood? Okay.
And it's not just me. We have a program called See-Click Fix, where you can report problems in the city of Fitchburg. And I looked the other day and I picked out some samples. The first one, there are rodents having a field day with the trash that's all over the street. The next one reports it's an ongoing issue. The next one, their request was open 6 days, still open. You flip the page, there's another one, still open after 6 days. There's another one, 7 days, acknowledged but not resolved. You go to the last page. The city of Fitchburg has 18,393 issues. Now, not all of these are trash, recycling, and yard waste. Some of them are other things like potholes, but a lot of them are missed pickups. Anytime I've looked over the years, there have been a lot of these problems. You compare us to Leominster, our twin city with a similar size population, 860 issues. yet the city keeps awarding the contract to Waste Management again and again. And I've asked Mr. Curry, why is this? He said, well, they're the low bidder. And I told him, well, you need to put a performance metric into the contract, so if a company isn't doing their job, they're not allowed to bid on the contract, and we don't keep getting this company again and again when they can't do the job. That has not happened, and we're still stuck with them today. I did also suggest to him that we could use some American Recovery Plan funds to start picking up the trash ourselves, as we did in the good old days. The ARPA has a whole section for health, and it's especially interested in health that includes equity issues. So I wanted to bring up some equity issues with the trash pickup. The first is use of private dumpsters. I think it was probably in 2018, my neighbor Kathleen saw me out trying to pick up the yard waste, which had fell into the street again. It had been over a month since it was supposed to be picked up, and despite numerous attempts by me to get it picked up, it didn't happen. And she said to me, yeah, they're so bad. She said, my sister works for the health department, and even I can't get them to come out. She said, I finally took my yard waste and I put it in the dumpster at work. Well, that's great if you have access to a dumpster at work, but not everybody does. That's an equity issue. Another thing is, well, you could take your waste to the city landfill. And right now we don't even have a charge to get a permit, which is great. There used to be a charge. But you've got to have a pickup truck with a bed you can put the waste in. Or you've got to have a trailer, which is a whole other set of registration fees. And have a big enough vehicle or a trailer, you can get it out there. Most people don't. That's an equity issue. You could say, well, you could hire a landscaper, and the landscaper could haul the yard waste away when they're done. Most people can't afford that. That's an equity issue. If you've got a large lot, say 1.71 acres, like Mr. Curry has, you can go and hide the waste someplace far from your house in the back corner, and it's not visible. Most people don't have that big a lot. That's an equity issue. So it's the poorer people and the lower income people, the working class people in the city who are really suffering with these issues with poor pickup. And if we're not going to start providing the service ourselves, like I think we could with the ARPA funding, at the very least I would ask that the Board of Health find that Waste Management has been negligent and deny them the opportunity to bid on contracts for a period of 10 years, starting with the expiration date of the current contract. There are many issues. Yeah, the trash gets out on the street, it attracts rodents, you've got the barrels filled with water, and you get mosquitoes, and they can create West Nile virus and Eastern equine encephalitis. You know, it's a mess. It's a mess.
Just for my clarification, Fitchburg provides essentially trash cans, one for regular waste and one for recycling. You have those, correct?
Yes.
Yeah. And who is it, Steve, who picks those up? Is that Waste Management?
Waste Management, yes,
So it's
sir.
Waste Management who does that. And so are you saying that you use those receptacles, but they're not being picked up every week or according to schedule? Is that what's happening?
They're not being picked up according to schedule. The worst is the yard waste. This past spring, I estimate they only came and got the yard waste when they were supposed to, like 10% of the time. The trash and the recycling, they're better at, but they're not completely consistent.
So yard waste doesn't go in those receptacles,
correct.
right? So
That is a separate collection. It is not every week. It is usually 16 weeks. This year we are doing 20 weeks of yard waste collection.
And is that, do neighborhoods get a schedule for that? So they know?
We encourage folks to sign up for what's called Recollect. It is on the webpage, and folks can download an app on their phone, but they do not need, it can be done from a landline. And we also utilize See-Click Fix to find out, like Ms. Wetchy said, to find out any issues. And if I may, Mr. Chairman, I can comment on those 3 issues on the first page. I am very familiar with it. I track it very closely. Actually, the 5 issues.
Yeah, go ahead.
The issue at 16 Washington Street, the trash collection has been rejected by the hauler because it's overflowing. It's a constant problem. We are working with the property owner to correct the problem. If you will look deeper into it, you will notice that that C-Click Fix issue has been assigned to an inspector. The inspector is monitoring it, and we are taking steps to seek compliance and work with the owner on that one. 88 Mount Vernon Street is another very similar problem. It was collected as of last week. That problem is now closed, but 88 Mount Vernon Street suffers very, very similar problem as 16 Washington Street. The next issue is 716 Main Street. If you'll check it closely, there is no such thing as 716 Main Street. We are in 700 Main Street. There are no residential buildings surrounding us. That issue has been closed. The next issue is the same, 716 Main Street. There is no such address. The next issue is 353 Clarendon Street. It's misrecycling, and the supervisors reported it collected after I gave it to them as a miss last week. I don't have the date in front of me, but it was collected within a couple of days.
How many, in a given week, do you know how many trash barrels have to be picked up by Waste Management?
So there are approximately 13,500 stops the entire week. So getting 3 to 5 misses out of 13,500 is a pretty darn good percentage if you run it by me.
Okay.
There are a lot of people who don't even bother to report it, they've given up.
Well, I can't fix a problem that I don't know about. So I encourage folks to utilize C-Click Fix if there is a miss. I also want to clarify that we do have rules. We expect our contractor Waste Management to enforce those rules. If you can't stay within the limits of our 96-gallon recycling bin and our 64-gallon trash bin, there are options, which will obviously cost you money, but the budget is based on those 2 barrels, and that if you can't stay in range of that, then you need to pay for the extra. It's very similar to use of a utility. You use the electricity, you pay for it.
Does the gentleman from Waste Management have a comment to make? Or?
I do, thank you. Yes, so I would like to reiterate what Director Curry had mentioned, that we follow all the rules and the regulations set forth by the city, specifically the Board of Health. And there are situations where we need to enforce those rules, and that causes a situation where there is a non-collection. Sometimes it could be the container's overfilled, it maybe contain unacceptable material, sometimes it may not be set out in a timely fashion where it would be serviced by our truck. So those are some of the common situations. We report those to the Board of Health on a daily basis. So I would just like to reiterate what Director Curry said, is that if there are any issues, residents have any questions or concerns about the collection of their material, to please contact the Board of Health. If there's been something that our driver has identified as a reason why that stop cannot be serviced, there's a good chance that they will be aware of that and they can direct the resident to the proper remedy. If in fact there is a legitimate missed item, whether it's trash, recycling, or yard waste, they will log that and get that information to us, and in most cases it would be collected the next day. I think the comment that there was like 18,000 or something issues, and many of them are related to Waste Management's collection, is a gross misrepresentation of our services, and we don't see nearly close to that many. And I think, as Director Curry mentioned, it might be a few a day that are reported to us, and as I indicated, those are collected promptly the next day in almost all cases. So we receive all of the any of the complaints or any of the reports of missed pickups every day. We're not anywhere near that number. Not only do we service 13,500 units per week for trash, but we also service half that number for recycling. So it's a grand total of 20,250 service opportunities that we are successful on. Almost, I'd say the vast majority of those every single week. And then when we throw yard waste on top of that, I mean, we are taking over 500 tons of yard waste off the streets of Fitchburg every year. It's a significant quantity of material that doesn't come from nowhere. So I just would like to emphasize that yard waste, while it is difficult to schedule yard waste in the same sense that it is to provide the same regularity with trash and recycling, because yard waste, unlike trash and recycling, is highly variable. We don't know from one day to the next, from 1 week to the next, to 1 year to the next, how much material is going to be at any given location. So with trash and recycling, it's very predictable. We know that there's going to be a barrel in each case, and it's going to be at a certain location, and we collect it accordingly. Yard waste could vary widely. Some locations may have nothing one week, one day, 1 year. And the next time we're there, it could have the whole curb could be lined up with material. We just don't know what to expect. So we, like anybody, we have to live in reality. We have constraints, we have parameters to our operation. And when we budget so many resources to provide the service to the city, and that's what we approach the job with. And sometimes if the job out on the street exceeds the ability of the resources we have allocated, then it might run a couple of days behind. I mean, that's not ideal, I understand that, but that's a reality. We just ask residents to be patient. It's not a public health issue like it would be with trash, for example. But I think that's just something that we would ask for people's patience and understanding with. Of course, this year with the pandemic in place, we know that I think most people have recognized that there's supply chain shortages. We see that when we go to the store. There's items that aren't on the shelves that usually are. There's additional wait times to when we order different material, and that's largely driven by truck driver shortages, supply chain shortages, et cetera, across the country. This isn't a waste management issue. It's not a waste industry issue. It's a national issue. And if it weren't a national issue, then I don't know why the president is addressing that with the Port of Los Angeles and Walmart and FedEx and other major corporations right now. So these are real issues that are affecting everybody, including us. So I mean, if we do, we're not immune to national forces that affect the nation. So if there's a supply chain issue and it takes us a week and a half instead of a day and a half to get a part, that might mean a truck is down for an extended period of time. That has real life consequences. And so, unfortunately, like I said, we're not immune to that, but we are doing our best. We prioritize our services in the order of trash, recycling, and then yard waste. We believe that that's the proper priority structure. And and I guess one other point I just wanted to make too is that the comment was made that barrels are attracting, trash on the street is attracting rodents. Well, I guess that's something that I struggle with because, while I certainly understand that trash on the street can attract rodents, if the trash is in the barrels, which is that's the proper parameter for the program, the trash must be in the barrel, it can't be overflowed. I don't understand why it would be on the street. Also, the other thing would be is, why would the barrels be filling up with water if they're, as a result of not being serviced, as was implied? Barrels should be filled and covered. So not really sure why the water would be getting in there and creating a mosquito issue unless residents were leaving the barrels open. That would be something that, look, I don't want to, I'm not in favor of mosquito infestations and spread of disease, certainly. But that sounds like that's an issue that would be need to be addressed, citywide with residents. And I don't know how that is related to our services. So I hope I've addressed everything there, but I'm happy to answer more questions.
Thank you. Before you ask, I just want to ask two real background questions. What is the reason why waste management or waste companies in general won't pick up an overfilled bin? Is it that things fall out and go all over the place, or?
That's exactly right. So it's actually to avoid the exact scenario that the complaint seems to be focused on right now, is that if the bin is overfilled, then what happens is when the automated arm comes from the truck and goes to lift it, it's prone to make a mess. It could be, and that's really the health issue is right there. So we don't want that to happen. We don't want trash ending up on the streets. We don't want a mess to be made, and that's why we don't want to service that. And that's actually, it's not just us, though. I mean, it's also part of the regulation that's established for the city. The city is paying for the disposal, and if and that disposal cost is benchmarked to the amount of material that properly fits inside the barrel. So if everybody is having 20-30% more material, that creates an additional cost to the city on the disposal side, and that's, like Director Curry said, there's other ways to handle that if the barrel is an inadequate amount of capacity. Those other avenues have a cost associated with them, but the idea is that residents who need to take advantage of that extra capacity, they're just being asked to pay for what they use. So it's also a cost consideration to the city, and the whole mechanism in place to help the city cover its costs is to direct residents who use more capacity and require more capacity to just kind of pay for what they use. And that, one or two people may not seem like a big deal, but when you spread that across 13,500 users, it really can have a significant cost when that's 52 weeks a year. So there's actually kind of two reasons there for that.
Thank you. And lastly, just as far as yard waste goes, is there some sort of regulation as to how that has to be packaged when it's picked up? Or, in other words, people don't throw a pile of sticks and rocks and everything into their backyard and expect you to come get it. It has to be put together in some way for pickup?
Correct, yeah. So, I mean, I don't have all the exact regulations at my fingertips, but I mean, just some examples would include, it can't, each container or bundle can't weigh more than 50 pounds. Rocks and sand and dirt are not considered yard waste. So that's something else to consider. I mean, stumps and things like that are not considered yard waste. So there's certain items that won't be collected, even though they've been put out at the curb, even though our driver may have been there, simply because they don't meet the program requirements. So I mean, that's something that I'm sure Steve Curry could comment on with a little more depth as far as what the exact specifics are for the city. But it's a great point to make, is that there are regulations in place. They need to be adhered to, and for the residents who adhere to them, they really should have a good experience. And in the event that something comes up, they have a question or concern, certainly contact the Board of Health, see Quick Fix is available, or certainly a phone call is also an option.
Thank you. Ms. Wetchy, you had another?
So to clarify a couple things, when I talk about water in the barrels, you have the option to put your yard waste in barrels or to put it in brown paper bags. And I put mine in barrels. They're marked all clearly with paint, yard waste, because that's, a one-time cost, and the barrel's good for many years versus having to buy bags all the time. And that is permitted. And if you don't come and pick up the yard waste, then the water gets in those barrels because they don't have the snap lid like the trash and recycling barrels do, and that's how you could get mosquitoes breeding. And I do have another comment, but you can go ahead, Steve.
Sure. If I have a question, if I may. Ms. Wetchy, do you live near or on a dead-end street?
Yes.
Do you have two options for collection on your dead-end street? Do you live on a corner lot?
Yes, but I put it along the driveway normally.
So there are two streets that you could potentially put waste on, correct?
Yes.
Have you ever put waste on St. Peter Street?
Yeah, that's normally where I put it.
Have you ever put waste on Belmont Street?
Occasionally.
Mr. Pasek, I'm not sure if you're familiar with collection, but as you know, dead-end streets are serviced by different trucks. They are not automated. It's collected by hand. I believe you call them ASL trucks. So there is the possibility that one truck goes by, does St. Peter Street, which is the dead-end street, and another truck goes by at a completely different time, does not go on St. Peter Street, and does Belmont Street. Thereby, the resident sees the truck goes by and doesn't think that there's collection going on, then the truck missed the street when it's actually the Belmont Street and not the St. Pete. You see my point here?
Yes.
I think the yard waste and the collection is moving a collection spot, and I think you identified one spot on your property where the collection site should occur and not change that because it is two different trucks, and it might be a large part of your problem.
I would say 99.999% of the time has been on St. Peter Street. One time I saw they went up St. Peter and then they didn't take mine, so I put it on Belmont, hoping they would take it when they came down Belmont, but that was very rare. Also, I do follow all the regulations. I don't, overfill the bin. I think, Mr. Curry, you can probably verify this, that whenever I've complained to you about the yard waste not being picked up, they've never said it's because I had an overfull barrel or I wasn't following regulations. It's always that Waste Management wasn't following their schedule.
That's correct, and there have been notifications and delays. Do you presently sign up for Recollect?
I have a printout on my fridge, I think, from which I got from you in April.
So, do you regularly schedule or regularly look at the calendar to see if there's
I look at it every
any
week.
service changes?
I don't go on the computer and look at it all the time.
So, there has been occasion on last year then Waste Management didn't have the staffing. So, rather than run a yard waste collection not to full capacity, we would move it for a week, and that has happened quite a few times. So if you're not paying attention to the collection time, how would you know it was missed?
Well, I do sometimes go online and check to see.
I don't doubt you've experienced delays, Ms. Wakey. That's not my argument. I just don't think 100% of your arguments are absolutely at the fault of the contractor.
Well, it used to be when I first moved to Fitchburg that you sent us something in the mail at the beginning of the year with the schedule and it was good all year.
Correct.
And now it's a burden on someone to have to constantly be going and checking the website. Did you change it for this week? Did you change it the next week? It should be consistent.
Ms. Wetchy, you as a taxpayer pay $8,000 a week for tax for yard waste collection. I want to make sure that $8,000 is the biggest bang for the buck. If I have to change the week, I have to change the week. If you are assigned to recollect, I can send you a notice. 4,000 people are signed up on it. I can send you a notice. 4,000 people get notified not to put your yard waste out this week. The concentration is trash and recycling. If yard waste has to be left out a week, so be it. We'll make that decision all day long, and I will never revert from that. As simple as that.
Yeah, Any further comments? I'd like to say I must have missed the course on trash collection in medical school because I'm very unfamiliar with it. But just in listening to the comments back and forth this evening, it seems to me that Waste Management's doing a fine job. You said there are something like 20-something thousand barrels that have to be collected every week, and granted it may be somewhat underreported, but there's not a huge number of complaints here given that. I think any baseball team would love to have somebody with that kind of an average. My own personal experience, I live in Fitchburg. I don't think we've ever not had our trash collected, and if it's a holiday or something, we're usually notified that it's going to be a day later or whatever. We've never had a problem. That's my personal experience. I'd like to make a motion that we allow Waste Management to finish out their contract as it currently exists and allow them to bid again when the time comes for rebidding. I think, at least in my opinion, they've done a fine job. I know no one's perfect. No one can be perfect, but for the size of the job they have, I think they've done a fine job.
Thank you.
I'll second that motion.
I'm in favor.
So I think we're in favor. Again, we appreciate your bringing these things to our attention. It certainly gives us things to think about, to look into, and to consider. We're in no way not listening to you or meaning to not give credence to what you say, but I think on both of the items today, we're going to kind of stay the course as we have been. So I think that ends that.
So we want to move to public health orders?
Yeah.
Thank you, Mr. Pasek.
Thank you, everyone. Have a good evening.
Thanks for educating us, and thanks for your time.
Thank you.
My pleasure. Thank you.
So we're going to move on to the public health orders. Who is doing that?
So,
Is this going to be, not that guy?
Yep, there we go.
Yeah.
Link for the participants. So there's two items on the agenda. I think it would be a good idea if we got some feedback. I believe Ms. Wetchy as well as Mr. Cordio, and I don't know who else is with us, but maybe we can listen to some feedback and then have a discussion.
One other person who has registered has not shown up on Zoom. Mr. Cordio is the only one who has shown up on Zoom.
Thank you, sir. Mr. Chairman, you get to select who goes first.
So, Ms. Wetchy, you have comments on this also?
I do, but you could let him go first if you want.
All right. It's Mr. Cordio then?
Mr. Cordio, yeah.
Okay, then why don't you go ahead, Mr. Cordio?
Hello, Council. Everybody can hear me all right?
Yes, we can.
All right, cool. So my question was just regarding, I saw the vaccine mandate was proposed here tonight. I was wondering what the thought process was, what you guys are looking to do there with that. Just as far as the numbers, I looked right from the CDC from January 2020 till September 15th of 2021. We've had 5.3 million infected children and 280 have passed away. That's very sad. But to keep that in perspective, if you look at the influenza numbers from 2017 to 2018, we had 530 deaths with school-aged children. And, you know, there was no mask mandates, there was no vaccines being mandated on children. You know, the flu is the flu. And like Ms. Wetchy kind of touched on earlier, I think that COVID's going to be with us for a long time. I think it's an endemic. It's not a pandemic anymore. And to ask parents to do this to their children, to put families in this type of position, I think would be not the way to go for the city. I'm not sure the thought process why it would be that way.
When you say do this to the children, are you talking about mask mandate now or vaccination, or both?
Vaccines.
So you're saying that if the vaccines become available for those from 5 to 12, that you don't think that it should be mandated to get those vaccines?
Correct.
Go ahead, Sandy.
What about all the
For 5
other
to 12 for any school age.
Excuse me? I'm sorry.
Well, I was saying for any school-aged child, not just 12, 16, 18.
All right.
I was going to make a comment about all of the childhood vaccines that are given to school-aged children in that age bracket in order for them to attend school. Mumps, measles, chickenpox, pertussis,
Polio.
yes, polio, hepatitis B, you name it. And these are all because of the vaccines that they're not an issue in the schools. The kids are not supposed to be in school without these vaccines.
So do you believe that COVID is as dangerous as polio to children?
Absolutely.
Is that what you're saying?
Absolutely.
Where do the numbers support that?
The kids that are getting sick. There are children that are getting sick.
I understand kids get sick, but do you understand what polio did to children back in the day? It's nothing compared to what COVID's done to people.
Well,
That's silly to compare
yeah,
this.
I don't know as if it's even necessary to say one is more dangerous than the other. They're both dangerous in their own way. Excuse me. I think we're spreading it. And so we're essentially wanting to protect children from all the illnesses that we can protect them from. Vaccines are safe. They've been given to millions of people now, and the incidence of problems related to giving vaccine are minimal. But getting COVID or any other infectious disease is not safe. So I'm having trouble understanding why people are resisting doing something safe to protect their friends and their family. To me, I'm just not sure why people are objecting to this.
Well, I think you're misinterpreting my point, Doctor, with all due respect. It's not about the efficacy of vaccines or if they're safe or not. It's about mandating parents to inject their children with a pharmaceutical product that they may not necessarily want to do in order for them to get a public education. You know, I don't feel like that's fair or safe at all for anybody.
If I may, Mr. Chairman? Yeah. Mr. Cordio, do you feel that children in extracurricular activity should be vaccinated? Sports, for example, or out-of-school activity?
I think that's a decision for their parents to make. I don't think that's something the government has any say over.
But yet you don't have any problem with the government saying that children must be vaccinated against, we won't even use polio, all the other vaccines that parents don't seem to have any problem with.
If you're asking my opinion about public schools and what goes on there, that's a completely different conversation. No, I don't agree with a lot of what goes on with public schools and a lot of what children have to put up with to be in public schools. I disagree with entirely. That's not what this conversation is about, though. This conversation is about COVID and mandating COVID vaccines, which is entirely new.
Actually, the two agenda items are school-aged COVID testing mandate and school-age vaccination mandate.
A school-age vaccination mandate, correct?
So that is the discussion.
Right, and I'm just wanted to put my opinion out there. I don't think that there should be a mandate put it on families and on children in this city. That's all. And I haven't heard a solid reason as to why there should be.
So just again, so I understand, are you saying you would be willing, it sounds as if you are, to send your child to school sitting in a classroom of 30 or 40 people all day in an unvaccinated status?
Me, my child's not going to go to public schools.
I'm sorry, your child's not going to go?
No, my child will not be public schooled.
Well, then, I think we're talking about public schools here. I don't think we can mandate what private schools do. But
Or at home.
yeah, I
Homeschool.
don't know if we lost him or. I think the mandate is for people in public schools. Is that correct?
That's correct.
Yeah. And I'm just asking him if he had a child in public school, his child went to public school, would he be willing to send his child sitting in a classroom of 30 people every day, an enclosed classroom, in an unvaccinated status? Is that?
And I believe he replied, his children wouldn't go to public schools, so I guess, how do you interpret that?
Is he saying they're not going, or they wouldn't go if that were the
They
mandate?
wouldn't go.
Mm-hmm. Well, that seems kind of an odd argument, because you won't send your kids to public school to take the risk, but you don't want to give a vaccine to prevent that risk. Seems kind of dire. I think maybe we lost Mr. Cordio.
I believe we did. I believe Ms. Wetchy does.
Yeah, that's what we can do.
Okay. I think you are rushing. The vaccine for children 12 and older is still under an emergency use authorization. We don't even have a vaccine for younger children yet. There are legitimate concerns that people have about these vaccines. The Moderna vaccine was just pulled from young men in 4 countries, Norway, Sweden, Finland, and I forget the other one, due to rare side effects that cause, I'm probably going to mispronounce this, myocarditis, a heart problem. So, people see these stories in the news and they are legitimately concerned. I think imposing a vaccine mandates on students is not a good idea. When my son was young, so I was more in tune with these things, I noticed that none of the kids in our neighborhood attended Fitchburg Public Schools. Some went to private schools, some to charter schools, some to other districts under school choice. So some families do have options, including homeschooling as well. If you impose this mandate, I think you will have some leaving the public schools, which will allow fewer per pupil reimbursements from the state to cover the fixed overhead costs in our schools, and will have a negative effect on our finances. Of course, not everyone has the option of other schooling. The schools could face lawsuits, which the city solicitor might not have time to respond to, necessitating the expense of outside counsel. There are at least 2 attorneys I know of who are fighting now on mask mandates against the Department of Elementary and Secondary Education. I could certainly see them jumping into this as well. Students are mandated to attend school until age 16. If they aren't allowed to because they are unvaccinated, the school truancy officer will file a CHINS petition, standing for Child in Need of Services, and then the child will be removed from his or her home, possibly even sent to a juvenile detention facility. These are severe consequences for an individual exercising his or her right to bodily integrity. The police could come and take the child away. We've been through this before as a country. Government officials decided they knew better than parents what is in the best interest of their children, and Native Americans to this day suffer the harm passed down through generations because government separated families for what they said was the good of society. I'm a little surprised you're contemplating this. In our state, a girl is allowed to have an abortion because she has the right to control her body, but you're going to say she doesn't have the right to control that same body by refusing a vaccine. The best way to get students vaccinated is not to force them, but to set an example for them. When I was flipping channels on TV the other day, I came across a city hearing in which Steve Curry reported that between 50% and 60% of police officers in the city of Fitchburg are vaccinated. These people who may come to take away the child for not going to school because the child is not vaccinated are up to half the time not vaccinated themselves. This is a part of a larger pattern in government of do as I say, not as I do, and it's not right. I'm vaccinated myself, and I believe that vaccines work, but it should be a matter of personal choice.
John. Psst. John.
Go ahead, yeah.
Do you feel this way about all vaccines or just the COVID vaccine?
I don't feel that anyone should be forcibly injected with a vaccine.
So no vaccine mandates?
Correct.
I don't think that's going to happen. I just don't see how we're separating the COVID vaccine from the other mandated vaccines. They were all new at one time.
Go ahead.
As I stated before, the ages 12 and over is still under an emergency use authorization. It's not a regularly approved vaccine. We don't even have a vaccine approved for children under 12. I don't know why you're rushing to put this order in place. Why the rush?
Well, I think that, number one, I think it's going to be approved very shortly, probably within a few days, for children under 12. I think it's been determined to be safe. And I think the rush is because children are getting ill, and we want to protect everyone we can by vaccinating him or her. So I think as soon as the vaccine is approved, then I would personally favor extending the mandate to that. And I agree. I think there are a number of vaccines that are mandated now. You can't, I think, go to school without polio vaccine, without measles, mumps, rubella, all of those things. And it's shown by vaccinating these individuals that we brought those diseases under control. And I think the same thing will happen with COVID. As much as you're surprised that we would think it should be required to vaccinate individuals, I think we're surprised that you resist this, that it's, I think it's proved to be safe. You mentioned the Moderna myocarditis. That is essentially a rare phenomenon. Every vaccine has rare associated phenomena, probably not much beyond what would happen without the vaccine, but everyone has a side effect. But if you take the number of people who are kept healthy against those numbers, it's overwhelming that vaccines work, that they've been well researched, that they're safe, and that you're not doing any harm to your children by having them injected. Again, I'm surprised that you resist this. I would be surprised. I couldn't conceive of sending one of my kids into a closed classroom for 5 days a week, 8 hours a day, whatever, with 30 other people, and not protect that child the best I could. So again, I think that's the reason why we've wanted to do the mandate. Go ahead.
I'm really surprised that you don't see any difference between a vaccine that only has received emergency use authorization and one that's fully approved. The mandates that Biden has put in or tried to have OSHA put in were not suggested earlier, as well as various employer mandates were not suggested earlier, including by the state, because they were waiting for the vaccine for adults to be fully approved. They said, we can't mandate that you do something when the vaccine is still on an emergency use authorization. Now you're saying it doesn't matter to us that these vaccines for children are on an emergency use authorization. The very first day we get that EUA, we're gonna go stick this mandate in place. Emergency use is not the same as regular approval. It hasn't gone through all the channels for you to say, you know, that this is all the same as other vaccines that children receive is not true.
Go ahead, Steve.
May I suggest a compromise to the board and refrain from a complete mandate in schools and start with extracurricular activity, sports, and require either vaccination or aggressive testing, or just plain 100% vaccination, and have further discussion at future meetings and accept feedback regarding obviously there's opinions out there, and maybe we should listen to them a little longer. But I just wanted to throw that compromise out there. If that's not where you want to go, that's fine, but.
So you're suggesting that rather than mandate, I hate that word, the 5 to 12 age category.
And we could deal with that when it
You want to
occurs.
just focus on the after-school programs.
Exactly. After-school programs that are outdoors, not required to wear a mask. You would be required to be vaccinated to participate.
I mean, I would be willing to consider that. I just know that maybe the kids aren't getting really, really sick in the schools, but the workflows in Maven are full of children. I can't tell you how many in this area, just this area alone, Leominster and Fitchburg, who are positive with COVID.
So essentially, what you're suggesting is that we continue the mandate for people over 12, because I don't think that's an emergency authorization. I think the vaccine's been approved for that age.
I was just suggesting we don't do the while they're in school, just the requirement to participate in extracurricular activity.
For the 5 to 12-year-olds, you're talking, or for everyone?
Well, that's up for discussion too, but I just assumed that we wouldn't go there until we had a vaccine to mandate. But
I'm sorry, I blanked out there for a minute. I apologize. What would be the thought process for withholding extracurricular activities from children? How is that going to keep them safer?
Presently, most of our cases are or seem to be in relation to sports or group activities outside of school. We're trying to reduce those cases by putting in some sort of a requirement to help.
So what is the goal of the board here? Do you guys want no children to ever get sick? Well, what is the goal
The
here?
goal of the Board of Health is to protect the public health of the city of Fitchburg.
I understand. You understand that people are going to get sick no
And
matter
you
what you
folks
put in, right?
are working on data, so I figured maybe some sort of compromise here and baby steps at a time, and we continue to get feedback on an overall mandate. But we do think about implementing some extracurricular activity mandates, because that's where a lot of the cases are.
Go ahead.
Here, if you want a baby step as a baby step, I would suggest to you, right now, I know you've run vaccination clinics in the schools for children 12 and up. I would suggest, since you do think that emergency use authorization will be coming for the younger children soon, that you run voluntary vaccination clinics in the schools for the younger children, ages 5 to 12, and let those who want to get the vaccine rather than mandating it.
That was my thought, yes.
Yeah.
I'm sorry,
Yes, that was my thought exactly. Before we put a mandate, see what the voluntary vaccination rate would be from 0 to 12.
I feel like that's a reasonable way to go also. I mean, we don't, rather than mandate it, there's that word again, rather than mandate it, let's see what will come forward from the, I mean, I don't expect a lot of parents to want their children to get it. I really don't. But a small portion would even be beneficial, I think, in the schools. Maybe it would be a larger amount, I don't know.
I would agree. I think it's reasonable.
I mean, I think they're going to.
I feel sorry for the kids whose parents would not have them
I do
vaccinated.
too.
Just my own personal feeling about it. But I understand the reluctance. Well, I don't understand it, but I'm aware that there is reluctance out there, even among adults. So.
It's about civil liberties, Doctor. It's civil liberties. It's not about being a good parent or not. It's
That's
simple civil
sad.
liberties.
That's really sad, I think, that it has to come down to that. When parents will let their children get
I
vaccinated.
do as well.
For the vaccines that are out there now, they don't have anything to say about them, but they won't allow, because of civil liberties, they won't allow their kids to be protected against COVID.
Well, because of civil liberties, they did allow their children to get protected by rubella and mumps and polio because it justified it. What it was doing to children justified it. What
And this
COVID
is
is
not
doing to children
justifying
does
it?
not justify it. What
I don't know
COVID is
how you
doing
can
to
say
children
that.
does not justify a vaccine mandate. It just doesn't.
Why? How?
I understand you guys want to keep people safe, and I appreciate all the work you guys do. I don't think you guys are, bad people at all. I think you all have the best intentions, but the way that this country was built, and parents have the right to treat their children the way they want to treat them, and to force them to inject them with something that they may not want to inject their child with is just wrong. I'm sorry, it's just wrong.
What if we did away with all the vaccines? We wouldn't have any people left.
That's not true.
Yes.
In fact, if you look at the statistics, a lot of the polio issue was actually sanitation. A lot of that stuff went away when we figured out how to plumb and get rid of our own waste. We weren't living in our own waste anymore. That actually helped the public just as much, if not more, than any of the mandated vaccines that we still currently take.
And what about people coming in from China and the other countries? How do you think TB got over here? It still continues to come over here. And it's because of
What does that have to do with the children of
programs.
Fitchburg? That has nothing to do with mandating vaccines on the children of Fitchburg.
Well, shall we make a motion that we will revisit this, that we will not mandate vaccine in the a group 12 and under?
We can table it. I would support tabling it for now,
Yeah. You know, I think this is
till it comes out.
obviously an emotional issue. I'd be curious about what you'll do with the herpes vaccine for your children for eventual development of head and neck cancers from, and cervical cancer from sexually transmitted herpes. Whether you think that's something that you ought to do or not.
Is that a question for me?
Yeah, for you.
How is that relevant?
Well, it's another vaccine. They're talking about a malaria vaccine in countries that have malaria. There are all sorts of...
Malaria kills millions of people in Africa every year, millions. A malaria vaccine is very well needed.
There have been more deaths from COVID now than there have from the influenza
1918.
from 1918.
Point,
More children died from influenza in 2017 than died from COVID last year.
Yeah, I'm not saying that's good either, but how many people would have died had we not given flu vaccines to people? It would have been even more. So,
Is the flu vaccine mandated?
no, I don't think it is.
Okay.
It is in certain places. You can't go and work in a hospital if you don't have the flu vaccine. You can't go into a hospital if you've had...
You can still get educated publicly, though.
Yes.
Okay.
Well, we'll take this under advisement, as they say, and, consider it. I think I would favor what Steve said, and that is that we not mandate vaccine in individuals 12 and under, or under 12, and that, but that we do mandate it in folks who are going to participate in sporting activities and, where they're breathing hard and shouting and spewing saliva over others, and in other post-school extracurricular activities. So I'll make that motion.
So before that motion is made, can I just, I understand you wanting to keep people safe. My fear with you guys going through and doing this is you're just going to drive parents and students away from our extracurricular activities.
Well, we hope we'll encourage them to get vaccinated so they can participate in those things.
So it's a carrot and a stick type governmental procedure here. That's what we're doing.
No, I'm just saying we hope we'll encourage. I'm not talking about carrot and stick. I'm talking about encouraging individuals to get vaccinated so they can participate in activities. You can't go on an airplane without wearing a mask. You can't go into certain restaurants without wearing a mask. You can't even travel to certain foreign countries without a vaccine. People can't come into this country without being vaccinated who are foreigners. So there's going to be lots of restrictions, all put in place with the idea of keeping people healthy and protecting everyone. I think it's a very small sacrifice to make to get a shot in your arm, which has been shown by millions now to be a safe treatment to get for the sake of trying to eliminate disease and keep people healthy. It may be your own civil liberties, but it's not the civil liberties of society as a whole not to get vaccinated. If individuals don't get vaccinated, they get sick, and it increases health costs for all of us, and it makes the disease stay here. We won't eliminate COVID, you're right, until people agree to get vaccinated and to do the things that we need to do to eliminate it. Until we do that, it is going to be here. As President Biden said, this is an epidemic of the unvaccinated. This is the people who are getting this, people who are spreading it, are the people, for the most part, are the people who are not vaccinated.
Do we have a motion on the floor, or? Did you
Yeah.
want, Ms. Jackman?
I was just a little confused on what you're voting on, because I thought that Mr. Curry had suggested that you first try voluntary vaccination clinics, and now you're talking about mandatory vaccines for people in extracurricular activities. It's not clear to me the age of the people in extracurricular activities that you're trying to mandate this for. And again, I would reiterate that that no child vaccines are fully approved yet. They're all on emergency use authorizations. Only adults have fully approved vaccines. So again, I don't see how you can force people to get something that hasn't even been fully approved yet. I think you should try the voluntary route as suggested by Mr. Curry first.
I think we heard from the school committee a few weeks ago, or at our last meeting, that they actually recommend this. They are very concerned that the football team does not have a season, and they have pointed out several schools are not having a football season because of it. And so they've made a strong suggestion that we really take a look at this. They outline that it is a privilege to play football and sports. So they've actually supported it, and I have found that, and I'm sure the nursing staff would agree in the health department, that many of the cases in schools happened before school even opened. And a lot of those were due to the sports that were taking on, the activities that were taking action before school opened.
John?
Go ahead.
So, the motion on the floor is to have all students what age group are we talking about? After-school sports be vaccinated? What is the high school students, or, I mean, are there after-school sports in the middle school? I think there are, like the junior leagues and the pee-wee leagues, I don't know what they're called, but.
Well, I don't know as if we have any say over what happens in, Babe Ruth or Little League Baseball. Those are separate
private.
from schools. Those are independent. But I think with respect to schools, I would agree that until the vaccine is deemed approved for certain age groups, that it would be not appropriate to mandate that someone for whom it is approved get it. But I think for those age groups for which it is approved, it's reasonable to indicate or mandate, the word we don't like, that those individuals to participate in extracurricular activities, sports and others, should be vaccinated. So that would be 12 and above, I guess, or above 12, I guess it is.
For Pfizer,
Right.
correct?
Yeah, mandating something that doesn't exist doesn't make a whole lot of sense at the
I
moment.
agree.
I mean, we can always address that at a future meeting. But I think the athletic department has a very large concern that their winter sports, especially the indoor sports, I don't know how you wear a mask running track. There's a lot of activities that are indoors. The percentages aren't that bad. The vaccination rate is, it's not terrible, but it's not 80%. And I think it would help with the winter sports activities to reduce the amount of cases. And I think the school committee strongly supports it.
So then we can rephrase the mandate to say that we would ask that all students aged 12 and up be vaccinated for after-school activities, public school activities.
Right.
Does that cover it, do you
Yeah.
think? Yeah.
I will say this is not something that I think that any of us enjoys doing.
No,
That
it's
is,
not. It's
ma-
painful.
Making these recommendations. But again, just trying to consider what the charge of the Board of Health is, that is to keep the population of Fitchburg as safe as we can. We think it's important to do that it's the right thing to do. We wish we didn't have to do it. We wish we didn't have this endemic disease or pandemic disease, whatever you want to call it. But I think that we have to do the things that are reasonable to protect the population. So I would second that motion, or that we indicate that individuals over 12 be vaccinated to participate in extracurricular activities.
And
I'm in favor.
so we're all in favor.
I think we're all
Is that unanimous?
in favor.
It was unanimous, yes. And I just wanted to make a comment, and I know it's kind of crazy, but, you know, when I was a kid, I don't remember my parents bickering, not bickering, but discussing how they didn't like for my siblings and myself to line up in the school auditorium and take a slug of polio, the Sabin vaccine, I think it was back then. And we all did it, and nothing was said. We all went home with our sore arms, and our parents never questioned it. We just did it. We did it with all the vaccines. What's happened that the society now has changed so much? I just don't get it. We're only trying to help our kids, our public. We're only trying to protect everybody. That's my comment.
Reasonable. All right,
I think
so that,
Jacqueline has something else to say.
oh, I'm sorry, go ahead.
Yeah, when you passed the vaccine mandate on school employees, you had exceptions for medical or religious reasons. You just now passed something with no exceptions. Another exception, which I know a lot of people include, is if you already have COVID and you can prove you've had it, so you had natural immunity, you don't need the vaccine. So are you going to put any exceptions at all for
I'll
people?
motion that we make an amendment to that, and I don't think that the motion that I'd like to amend is to say that we have religious exemptions and medical exemptions. The fact that someone has had COVID in the past does not mean anything. You can wait 90 days, the antibodies are gone, if not before then. So I think that everything else should stand.
I would second that amendment. I think that's a reasonable thing to raise.
Thanks for bringing that up.
The legal exemptions would exist, whether that was mentioned or not, but they've clarified it, but the exemptions are required to be there by law.
Okay, I think, have we covered pretty much all of the
I think we have.
subjects? Again, I want to thank Mr. Cordio and Ms. Wetchy for your input. It makes us think. That's difficult sometimes, but we appreciate it very much. We'll certainly listen if you have other points that you'd like to make, and we're just trying to work through doing the safest thing we can. I know wearing masks, getting injections, all these things are a nuisance, but we continue to believe that the science says that it's the right thing to do, and it's best protection for our whole population. So again, thanks for taking the time to make your comments. We appreciate it.
Thank you as well for the time.
Move on to the next issue.
Yes.
I don't think everybody has read the minutes.
I'm not ready for the minutes that we have that's been provided to us, the September 23rd one. I mean, those are long minutes, and I need some time for those. And we don't have the September 2nd ones yet, so if you can get those out to us, we'll be ready next meeting.
So do you want to table them for the next meeting?
Thank you, yes.
Yeah.
Do you have any objection to draft minutes? Ms. Wetchy has requested a copy of the minutes. Do you have any objection to supplying Ms. Wetchy a draft copy? Obviously to be amended if needed at a future meeting? Is that a happy compromise?
Steve, why a draft copy and not a final copy?
Well, if you don't have an issue, I'll give her the final copy. I'm just concerned that after you read them, something may have been taken out of context that is in the minutes, and you might be
No, I'm just wondering,
against the comment that is in writing.
just by draft, aren't we implying that those are,
I'm implying that they could be amended.
yeah. What would be the problem with just waiting for the final minutes once we've had a chance to look at them and
No
amend
problem.
them?
I was just looking for a compromise. Ms. Wetchy has put a complaint in that the minutes aren't being posted at a timely fashion, so
Yeah.
I was trying to
Well,
meet some happy
I know
compromise.
Karen does an excellent job, but I'd just like to be sure that everything is accurate before we put them out,
Understand?
if that would be all right. Is that okay with you, Karen? All right, but we'll, beyond that, I think we're happy to supply minutes. At least I am. Any? As far as the landfill, is that?
So I'll give a quick update to the board.
Should we make a
Just-
motion to table those items? I'll make a quick motion to table the minutes of September 2nd.
Oh, okay.
3rd.
I'll second
I'll
that.
and I agree.
Thank you, Ian. I completely forgot about that. So I just want to inform the board of what is happening up at the landfill. The landfill, of course, is in the town of Westminster. So the Westminster Board of Health on September 20th held a site assignment hearing to amend their present site assignment at the landfill. As the landfill is currently proposing to expand, the landfill is actually going to go up. It will go from 10,080 feet to approximately 1,158 feet. The tons per day will not change. The acreage, I believe it will increase by 1.81 acres with this proposal to the Westminster Board of Health. So I just wanted to update the board on that. The Westminster Board of Health has 45 days to make a decision on that proposal. The proposal has been issued a report of suitability from the Massachusetts Department of Public Health. So the Board of Health approval is the next step, and as you folks are familiar, site assignments are very long and arduous. But I just wanted to throw that out there, and just as an update.
How much time do you think that will buy the landfill?
So it's estimated with the tonnage, no change in the tonnage, we would get 3 to 5 years more space out of that, and in the meantime, would explore further expansion to continue its service.
Because at one point, didn't we talk into spreading out into the,
That is correct. There has been a proposal out there to acquire land from the Department of Conservation and Recreation, and a land exchange and land swap for approximately 185 acres for 85 acres next to the landfill. But there's been a little bit of opposition to that, and being that the landfill is going to reach capacity at 2024, it was starting to run out of time on that expansion. So going up made more sense temporarily until we can address the problems of the expansion.
could you repeat those numbers again, the square footages that you gave in the beginning, the differences?
Sure. So the landfill is located in approximately 223.8 acres of adjoining parcels of land, of which 94.8 acres have been used for solid waste disposal. The landfill will continue to receive the same waste materials type currently permitted for acceptance, including municipal solid waste, industrial waste, ash, soil, sludge, asbestos-containing material, and special waste. Operation is authorized at a maximum daily waste acceptance rate of 1,725 tons per day, 312 days per year. The applicant is seeking to modify the existing site assignment for the Fitchburg Westminster landfill for the purpose of increasing the maximum height from 1,080 feet to approximately 1,158 feet above mean sea level, and increasing the total site assigned area from approximately 188.7 acres to 190.51.
Thanks, I'm
I
sorry.
think that's what you were asking.
I didn't mean for you to have to do that whole spiel,
Sorry,
but
I
I
just didn't-
appreciate it.
I wanted to make sure I was looking at the right numbers in the paragraph.
You had said some other numbers in the beginning, but it doesn't really matter. I mean,
Okay.
it's growing, and that's the bottom line.
Correct, not by much, a couple of acres.
Yeah, right, thanks, sorry.
Going on, no problem.
Is there a monetary cost to the city to do this?
I'm sorry, is there what now?
Does the city have to pay more to do this, to increase
So
the size?
the city would not bear any cost, but the city would continue to reap the benefits of the Fitchburg Westminster landfill.
Oh, okay. So, seems to make sense. All right. Is there any other business to discuss that we haven't discussed?
That's
or-
all I have.
Okay. Then, may I have a motion
I
to?
will make a motion to adjourn.
Okay, I get to hit this gavel.
Oh, you woke me,
Meeting
you
is
scared
adjourned.
me.